Greg Newson here, and I thought we'd discuss in this video irritable bowel syndrome. Now, irritable bowel is also known as IBS, and it used to be known as nervous indigestion, spastic colon, irritable colon syndrome. Now, those terminologies have kind of fallen a lot by the wayside, and we generally refer it to now as irritable bowel or IBS. So IBS, it's a quite common condition, and it accounts for almost 50% of all the gastrointestinal complaints that people go to the doctors for. Now, it generally affects adults, but it can also affect children. It's not discriminative with age, it's just more common in adults and more common in women than males. But males can still get it and kids can still get it. So, what is it? Well, there's a conglomeration of common signs and symptoms that are associated with irritable bowel. Obviously, one of the more common ones is the griping pain that people can get in the lower part of their gut, which is around the colon area, and that causes that colon to go into spasm, and that can, if you get a cramp in your leg, if you can picture getting a cramp in a muscle, that's the same thing that's supposed to be happening within the gut, and that can cause a lot of pain. But associated with that, there can be a variety of stools, bowel motion. So some people may get constipated and not go to the toilet for a couple of days. Other people may go to the toilet daily, but the stools are really dry and hard and pebbly. The stools may then alternate, they may not, but they may alternate into more loose stools all the way through to really like watery, diarrhea type stools. Now, with that you can get a lot of flatulence, gas, and bloating, so your stomach feels like it's out there and you're a couple of months pregnant. Now, that are the more common signs and symptoms, and not every sufferer of irritable bowel can get that because it varies from person to person. Some less common signs, but that are also associated with IBS is fatigue, muscle aches and pains, nausea, vomiting, heartburn, reflux, headaches. So there's a lot of other potential symptoms that are also associated with IBS. It's just not the gut-related, the bloating, the loose stools, and the abdominal pain. Now, that's I suppose a quick rundown of what it is and how common it is, but what causes it? Now, this is the million-dollar question. The causes vary from person to person. So if I had irritable bowel and you have irritable bowel, what affects me will not necessarily affect you. So what you need to do and have the mindset to do is to play a bit of Sherlock Holmes, is to investigate certain potential problems, either eliminate them, no, I don't have that problem, or yes, that's causing my problems, then deal with it and get rid of it. Because irritable bowel, contrary to public belief, is not a lifelong condition that you need to put up with for the next 30 or 40 or 50 years. Once you get rid of the underlying irritants that are causing irritable bowel, that's it, it's gone. And you then live a normal happy life with a normal happy bowel motion, without the smelly poo and without the bloating, without the pain, without the gas, right? You still end up looking like a ripe firm banana, and that's the way it should be. So, the causes, as I say, vary from person to person. So, when I treat irritable bowel in clinic, I am generally going through a list, and I'm going to kind of explain that list to you now, just so you can get a bit of an understanding of why and what you can also do yourself. So the first thing is food. Now, the diet plays a major role. There's the saying that one man's food is another man's poison is very, very true. So what I can tolerate might be completely different to what you can tolerate. I might be able to eat bananas, pears, apples and grapes, but those food items for you really give you curry, and they really upset the abdominal area, and they bring all the symptoms of IBS along. So we generally organise a food allergy test or a food sensitivity test, a food biocompatibility test, and eliminate the potential allergen foods, because anything that you're allergic to will irritate the lining of the intestinal tract. Talking about irritating the lining of the intestinal tract, even before I actually go on to looking at foods, we eliminate dairy and we eliminate gluten, because they are two common allergens that cause a lot of gastrointestinal problems. Either if with the dairy you don't have enough the enzyme to break down lactose. So the sugar in milk is lactose. The enzyme that breaks down lactose is lactase. When you were a baby and you were suckling your mother's breast milk, you had lots of lactase. But as you age, you're weaned off the breast milk, the body's production of lactase goes down. Now, in Jewish cultures, in Asian cultures, in societies, I should say, and African American or African, they don't tolerate dairy very well at all because of the lactase levels are quite low. So if you're having a glass of milk or an ice cream and you're getting those griping pains, that could be as simple as it is for you. You just may not have enough lactase. Gluten, this is not for people that suffer from celiac disease, which is you can't process the gluten at all, and there's a lot of blood in the stool, there's a lot of abdominal pain, you react quite severely to gluten. But gluten is a hard molecule that needs to be broken down, so you've got to have a lot of vitality and a lot of energy in that digestive tract. If you don't, gluten can be quite irritating. So, think of it this way. Get a piece of sandpaper, rub it on the inside of your arm. Please don't do this, but I'm just using this as an analogy. Rub it on the inside of the arm, and you're going to find that that area there gets really red, really irritated, and really sore. That's what gluten will do to the intestinal tract every time you have it, if you are sensitive to it, or if it is already irritated and inflamed. So, best way to fix that up is get rid of it. Just cut them out for the time being. Okay. So, obviously we want to look at food allergies. There is another area of food that needs to be investigated. There's a doctor called Dr. Sue Shepherd, and she put together the FODMAPs diet. Now, the FODMAPs diet is there's certain carbohydrates, certain chemicals within foods that actually exacerbate and irritate irritable bowel. So, if you're reading this blog, there's a free download that you can, obviously download, a PDF that you can download, and you can list all the foods that you're to avoid and all the foods that you can have if you want to stick to the FODMAPs diet. And I generally get people to do that because a lot of people find that the majority of their symptoms improve dramatically over that time when they've eliminated the potential foods that can cause problems, right? Whether it be the allergy foods or the FODMAPs type foods. Now, talking about FODMAPs, if you have a dramatic improvement on fructose or fructans, which is certain chemical components of food that's found in the FODMAPs diet, it generally indicates that you're most probably going to be suffering from either a small intestinal bacterial overgrowth, which is a whole heap of detrimental organisms, so there's not enough good guys in the small intestine and there's too many bad guys. They can create chemicals and chemical reactions which will irritate the colon, and what we call small intestinal bacterial overgrowth, SIBO, it mimics irritable bowel, right? So if that being the case, that has to be treated. We have to get rid of the detrimental organisms. And there's various herbs and various nutritional supplements that will either get rid of the protective barrier around the organisms in the small intestine, and that's what we call the biofilm, or it will kill those bacteria or organisms for good. Because that's very important, because if they're the underlying cause, that means every time you have those foods you're going to react. Now, the same thing can happen in the colon. You can have an overgrowth of detrimental organisms, whether it be Candida or Blastocystis hominis or Dientamoeba or other organisms that can potentially irritate the colon and cause irritable bowel. So if I just put all that together in a word called dysbiosis, which basically means too many bad guys and not enough good guys. So it's really, really, really important that if you've got an improvement with the food, we need to look at dysbiosis. And even if you don't have an improvement with the food, we still have to look at dysbiosis, because the amount of... Okay, I'll go back just half a step, just to explain a little bit. Within the intestinal tract, within the body, there is trillions of cells, right? There is much more beneficial bacteria in the gut than there are cells in your body. Now, those beneficial bacteria keep you alive. They live in a symbiotic relationship with you. So if they die, you die. If you die, they die, right? So obviously they don't want to die and they don't want you to die. And they are making vitamins. They make B12, they make vitamin B6, they make vitamin K2, they make folic acid or folate, they make biotin. So they're very, very important to give the body the nutrients it needs. They also convert fibres into food for the cells of the colon, and they prevent cancer. Right? They lower cholesterol levels. They're very, 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 very important. So what happens in a dysbiosis type relationship is that, you know, you should have good guys here and bad guys down there. Well, it's around the other way. You've got too many bad guys and not enough good guys. So we need to get rid of the bad guys and increase the good guys, and in 90% of the cases that gets rid of irritable bowel, right? It's that important, right? So it's really, really, really important. So there is tests available that you can investigate Candida and the whole dysbiosis and SIBO. Information further on down in this blog or on our website, vitalityandwellness.com.au. If you're looking at it on YouTube, just go to the website and type in irritable bowel, and you will come up with the blog with all the links that will be of benefit. So if we're still talking about food, alcohol is a no-no, can't have it, you know. Go cut yourself again. That rash that you've got on your arm, go get some alcohol and pour on it. You know, put a bit of vodka on it. It's going to sting. It's going to hurt. When that happens in the intestinal tract, everything cramps up like that. You get a lot of pain, and the body's going, "Oh, I don't want you," like it does with the lactose or the gluten or the irritating food. It just shoots it back out very quickly in the form of diarrhea. So, junk food, you know, that's without saying, that's kind of, now it's kind of a given. Now you might think, if you look at the FODMAP's diet, you'll go, oh, hang on a second, I can't have all these fruits, because certain fruits and certain foods will irritate the intestinal tract. What else? Where else? Now, leaky gut syndrome. Sorry, I'm trying to think of what I do with patients. Leaky gut syndrome is a condition in which microscopic holes appear in the gut wall. So basically, if you picture your gut and the cells in the gut are joined together by bits of cement, like the house bricks in your house, that cement dissolves. That allows undigested food, bacteria byproducts, poisons, severe cases, feces to pass into the bloodstream, which causes a whole heap of health problems, and it really upsets poor liver function. Now, the leaky gut syndrome mimics irritable bowel, and irritable bowel mimics leaky gut syndrome. Now, people that have irritable bowel also have leaky gut syndrome. People that have dysbiosis also have leaky gut syndrome. People that have Candida also have leaky gut syndrome, right? So these all goes hand in hand. Now, one other thing that will cause irritable bowel is stress. Now, stress, the three general emotional conditions that are related to irritable bowel is anxiety, worry, and nervousness. Now, this is something interesting that I found when studying Chinese medicine and other cultures as well, is that they believe that various organs have an emotional attachment. So a particular emotion is attached to a particular organ. Now, and when that emotional issue gets worse, that organ is struggling. Now, for example, fear and panic is associated with kidney function, right? Anger and irritability is liver. Love is heart. Sadness is immune system. The colon is anxiety, anxiety, nervousness, and worry. So they're the big emotions associated with colon. So people that have irritable bowel generally have more of those emotional anxiety, worry, and nervousness than the general population. Now, stress increases dysbiosis. Stress kills the good bacteria. Stress causes leaky gut syndrome. So there's a lot that needs to be done. The first thing that I generally do is look at patients' GABA levels. Now, GABA is your major relaxing, calming, tranquilizing, chill out brain chemical. Now, people with low GABA, right, it's the brain chemical, low GABA, anxiety, panic attacks, nervousness, worry, insomnia, racing mind, tick, 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 and epilepsy, convulsion, right? So they are the conditions associated with low GABA. So obviously some of those are associated with digestion or the intestinal tract. But GABA is paramount for proper digestive function. So you need to be calm and relaxed to assimilate the nutrients out of the food. Like they do in the European countries where they have a siesta. they have a long lunch and they just relax and they eat well, and they generally, the Mediterranean people, they generally live a healthier life, and even French, with the French paradox, their health, even though their diet might be as good as what we're trying to achieve, here their health is a lot better because they're less stressed. Their digestion is a lot better because they're absorbing more nutrients out of the food. GABA is extremely important to secrete the digestive enzymes within the body, right? So giving the nutrients to improve GABA levels is very important. And interestingly, to repair the gut. So if you've got leaky gut, you've got damage to the gut wall, there's an amino acid called glutamine, which is essential to repair damage to the gut. Glutamine is also the precursor to the manufacture of GABA. To make GABA, you need zinc. Zinc is essential for wound healing and repair, i.e. leaky gut. You need vitamin B6. Dysbiosis destroys vitamin B6, or it inhibits the production effectively of vitamin B6 from the beneficial bacteria. So they all play a role. They've all got this, everything within the body has got this role. It's just not one thing sitting out there. It's generally a conglomeration of issues or complaints that are causing or worsening your irritable bowel. Now, if we talk about irritable bowel actually will cause certain, or exacerbate, not necessarily cause, but it can cause, but exacerbate certain health conditions. So it will worsen pylorrhea. Now, pylorrhea is a condition in which a substance that is produced by hemoglobin called HPL robs the body of zinc, biotin and B6. Now, irritable bowel, leaky gut syndrome, stress, poor diet, they will all worsen pylorrhea. So if you've got irritable bowel and you've got a lot of diarrhea and you're not producing the B6 and the biotin from the beneficial bacteria, you are actually going to exacerbate or worsen pylorrhea. Depression. Strangely enough, most people are going, what? But depression is quite common, a common side effect or a common cause of irritable bowel syndrome. And the reason why is the chemical, or the brain chemical that makes us happy, our happy brain chemical, is called serotonin. People with low serotonin are generally suffering depression. So you go to the doctors, you get an antidepressant. It's called an SSRI, a selective serotonin reuptake inhibitor, which basically means it makes serotonin stay in the brain longer. But 90% of the serotonin that is produced in the body is stored in the enterochromaffin cells, big word, enterochromaffin cells that line the intestinal tract and the respiratory tract. So the intestinal tract's a lot longer than the respiratory tract, so there's more enterochromaffin cells in the intestinal tract. If that is damaged, you don't produce enough serotonin. If you don't produce enough serotonin, you get depressed, and you get insomnia, and you get angry, and you get carbohydrate cravings, and you put on weight. So it's also associated, so pretty much any mental health condition that relies on serotonin, or GABA for that matter, will be exacerbated by irritable bowel syndrome, as will any immunological condition, because, believe it or not, 70% of the body's immune system lives in the intestinal tract, and it's strengthened and it's supported and it's rejuvenated by the beneficial gut bacteria. So if the beneficial gut bacteria are low, and the house where the beneficial bacteria are supposed to live is dirty, is irritable, it's not healthy, as is with irritable bowel syndrome, you're going to suffer more chance of having autoimmune diseases, whether it be psoriasis, Hashimoto's, rheumatoid arthritis, or just immunological conditions like recurring infections, allergies, quite common, peanut allergies, food allergies, right? So it's important to understand that it's just not affecting the gut, but it can be affecting a whole heap of other areas of the body. And like malabsorption, if the gut's not right, you don't absorb the nutrients of the food, every single cell in your body will suffer. Every single cell. Because the digestive tract is where you absorb the nutrients of the food and you get rid of the bulk of the waste. Okay, so I've rambled a bit there, so I apologise. Got on a little bit of a roll. So what should you do next? The first thing that I would recommend is find yourself a good healthcare practitioner. And generally, like I'm a naturopath, I'm a herbalist, I'm a nutritionist, so I'm obviously going to be recommending those type of people. But Chinese medicine practitioner. Look, some doctors can be quite that understand these principles can be quite helpful. your local GP may not have enough knowledge in treating this, but it's good for a bit of a diagnosis and to run some tests. Definitely start looking at the diet. Get rid of the gluten, get rid of the dairy, investigate food allergies or sensitivities. Look at implementing the FODMAPs diet. The next step that you want to do is investigate dysbiosis, Candida, SIBO if you feel that if the other two don't improve, and just check out SIBO. But I'd do the first two and then I'd move on to SIBO. I would then look at ways of reducing stress. Start exercising. Obviously eating better is going to reduce stress. Obviously improving GABA levels, taking nutrients that naturally increase GABA, the glutamine, the zinc, the B6, theanine, chamomile, passion flower, noni, glycine. They're all nutrients that will help improve GABA levels. So, and I suppose above all, have faith that it's going to work. Believe in yourself. Think, I can do this. It's not a difficult thing to get rid of. You just may need a bit of direction, right? So again, find a health practitioner. If you can't find one, happy to help. We can Skype, phone consult, in-clinic consultations. Team of naturopaths, so we kind of do this all the time, so we know what we're looking at. So if you're after any more information on tests, there is tests on our website that will test. There's a dysbiosis test, a Candida test, 2 tests that I recommend. There's a food biocompatibility test, there's a food sensitivity test. There's the information on the FODMAPs in the blog post or on www.vitalityandwellness.com.au, and you'll get a whole heap of information there to help you with the diet. So hopefully that's given you a bit more of an understanding of what irritable bowel is, what the potential side effects of it are, what are the potential underlying causes, and what actually can irritable bowel lead to in the future, and more importantly, what you can do to get rid of irritable bowel. So it's not a lifelong condition, it's not something that's going to be dragging you down, it's not something that's going to be causing you embarrassment, it's not something that you're going to go, where's the local toilet? I can't go more than 5 minutes without knowing where the toilet is. So if you put the strategies together, you will get rid of it and you will be symptom-free for life. So hopefully you've liked the video. If you have, please leave a comment, let us know. Like us here on YouTube, subscribe to our YouTube channel, because we're going to be putting a lot more videos out on a whole heap of health conditions. Plus, we're putting out a lot of videos on particular foods and the health benefits of individual foods, so you can then start to get more of an understanding of what foods can do to enhance your health. By all means, tweet us on Twitter and post us on Facebook, because the more people we can help and the more people can get direction, the happier the world's going to be. Anyway, until next time, this is Greg. You guys have a wonderful day.